Hi, Barbara Wally here, orthopedic and sports certified physical therapist, to talk to you about why you should do physical therapy. So, other than it's good for you, like your vegetables, so just take it, I'm going to talk about some details about why exactly physical therapy would be the right choice for you. Now, thinking about your copay and deductible, especially with every year it gets more expensive, it is cheaper than the deductible, especially with imaging. So if you're wanting to get that x-ray or MRI, it is oftentimes way more cheap than having to pay the deductible for an MRI. I know I had an MRI years ago and I had to pay $1,500 on a high deductible plan to have an MRI done. It's much more reversible than surgery. So if you have surgery and that's your first line of defense before trying other things like massage or acupuncture or physical therapy, it is oftentimes the thing that you do that has the least ability to reverse what you've done. It gives you a greater sense of control over your pain, gives you something to do about it than just having to pop a pill. And also, it gives you more of a just put up or shut up kind of approach. You can actually have some control over what you can do. It can also help enable you to self-manage your pain and help decrease your pain. And believe it or not, it actually oftentimes works. And if you see a physical therapist who knows what they're talking about or is worth their salt, they're going to tell you if they can help you. And if you're not appropriate, they're not going to make you keep coming. Jury's still out on some places and some people, but it's just like anything in life. You just got to use good common sense and find the right fit for you. But what would a session look like with me as an online telehealth physical therapist? So there is still paperwork. I'm sorry, you're not going to get away from paperwork with me, but I've had some people do the paperwork. It takes them 5 minutes electronically. You can do it at any point up till your session. I typically ask, please give me a day before your session so I can review the paperwork. Some people it's taken 15 to 20 minutes, depending on how detailed you are, but you can do it on your phone. You can do it on the computer as well, but you don't want to do it and then come back to it because it won't save. You just want to sit and do it all in one fell swoop. But the sessions, the actual sessions, will schedule the time and would meet via phone, via tablet, or via a laptop or desktop computer that has a camera on it. And the sessions are typically going to be 45 minutes to an hour. I'd prefer a full hour to give it, all of the things that we need to do. And I'd do an evaluation. I'd sit and talk to you about your paperwork, review the paperwork with you and why I had you do what we did. And then I'd actually take a look at you, see how you move, see what you look like, see what your strength and the way you hold yourself looks like, your range of motion, etc. And I can even, if I see some changes, I can actually take a still shot of a photograph or even a short video of how you are moving. And then I can also take measurements. I can literally measure how your back is moving, measure how your shoulder's moving, so that I've got some comparison from where you start to where you end up. And we can also sit and review your home exercise program. So I would actually design a customized home exercise program and have you go through and make sure you know how to do the exercises that I give you. And then I have software where I would issue the home exercise program with photos and videos of how to do the exercises. And we can review that as well before we're done. And then you can decide, do you want to follow up in a few days, in a week, by the end of the 3 to 4 weeks, because that's the limitation. The 4 states that I am certified to treat folks who reside in those states are South Carolina, Georgia, North Carolina, and Pennsylvania. And I've got 4 weeks for all of the states except Georgia is 3 weeks. So we can decide when we want to follow up, or maybe not. Maybe it's a one and done shot. But who typically is going to be the best choice for physical therapy, especially online? Those who don't have a lot of time. You don't have a lot of time to drive. So you've literally got the hour for the session and that's it. You've got some quiet time before work, after work, over your lunch hour. If you're a stay-at-home mom or you're homebound, we can do it at any time during the day. But preferably someone who knows how to use their phone, a laptop, a tablet, a computer, have some degree of tech savvy, because you would have to fill your paperwork out online, or have somebody there with you that can help you to do that. Someone who's independent, that's going to be key, because I'm going to give you a home exercise program and expect you to follow through with it, and other recommendations as well. Someone who is engaged and somebody who is focused on quality, because that's what I'm all about, is quality. So hope this is helpful. If you'd like to reach out to me, please visit my website, Dr. Barb Wally, DrBarb WALLY.com, and click on request an appointment, or you can send me an email to talk more about scheduling a session for you. But I hope this is helpful, and I hope you have a wonderful day. Thanks for listening.